While Original Medicare might cover your medical service, that doesn't mean it was 100% paid for. Coming up next, what a Medigap plan is and how it supplements your core Medicare coverage.
Hi, it's Sonia Jensen here from Jensen Insurance Agency. Today I want to talk to you about
Going without supplemental medical coverage can be risky, and that's why many Medicare beneficiaries choose Medigap plan to fill the gaps of Original Medicare. A Medigap plan, which is what we'll call it from here on out, is a health insurance plan designed to coordinate with Original Medicare Part A and Part B. Medical claims are first processed through Medicare, and then they're passed along to the Medigap plan as a supplement. If a medical provider accepts Original Medicare coverage, they must also accept your Medigap plan with any insurance carrier. Medigap plans aren't really making decisions on claims. They instead follow what Medicare does. If Medicare approves the service, the Medigap plan will pay its part after Medicare pays theirs. If Medicare does not approve a service, the Medigap plan will not either. Here's a quick visual of what we're talking about. Parts A and Part B act as the primary, and then the Medigap plan as the supplement. So, what is covered by Part A and Part B as the primary coverage? Great question. Part A covers hospital services when admitted as an inpatient, skilled nursing facility care, hospice, and some home health services and more. Part B, or outpatient, covers a long list of services. Here are just visits to your primary doctor or specialist, medical treatments and tests, laboratory tests, durable medical equipment like wheelchairs, oxygen, CPAP machines, outpatient surgery, ambulance services, and much. There are a number of Medigap plans available, but of course, they use letters to confuse. You might have noticed a few Medigap plans on this list that appear to look familiar. Plan A, Plan B, Plan C, Plan D. Now don't be fooled. Those are Medigap plans. You should not confuse them with Medicare Part A, Part B, Part C, and Part D. So be sure and keep that straight. As of January 1, 2020, there are new rules on which plans are available. Those initially eligible for Medicare prior to 2020 can purchase any of the plans you see listed, even Plan F and Plan C. Now, those initially eligible for Medicare in 2020 or after must choose from the plan options listed in the middle. Plans A, B, D, G, high deductible G, K, L, M, and N. They cannot purchase Plan F or Plan C. Note, since these plans are standardized nationally, that means each plan letter has the same coverage. For example, Plan F with one insurance carrier is the same as Plan F with another. Additional note, not every plan is available in every state and by every insurance carrier. This is just the standardized list. Also, Massachusetts, Minnesota, and Wisconsin have different variations of some of these plans. So, when can you buy one? Well, first of all, as long as you are 65 and enrolled in Part A and Part B of Original Medicare, you can buy a Medigap plan literally any month of the year. It's just there are special times when your plan acceptance is guaranteed without medical underwriting, meaning they cannot ask any medical history questions about pre-existing conditions. So let's look at the 3 common guaranteed acceptance situations. First is you're turning 65 and your Part B is about to start. From your Part B start date, you have 6 months to purchase Medigap plan without the medical questions. If your Part B is set to begin July 1st, you can start your Medigap plan in July, August, September, October, November, December, or January without those medical questions. Another scenario is you are already 65 but delayed Part B for a future date. It works the same way here. You have a 6-month time frame to get a Medigap plan without medical questions. Lastly, if you're enrolled in Part A and Part B after the age of 65, but you lose your group health coverage. Now, this is a little bit different and varies widely from state to state and insurance carrier to insurance carrier. You have up to 2 months from your loss of coverage date, but you may not have access to the same Medigap plan letters. So some plans are not available on a guaranteed issue basis in this situation. Now, what if you want to change your Medigap plan? This is relatively simple. You can actually switch from one Medigap plan to another with the same insurance carrier or even a different insurance carrier at any time of the year. What? I know, you're probably surprised by this. The only wild card is whether or not there will be medical history questions. As I mentioned earlier, you have 6 months from your Part B start date to make a change without medical questions. But after 6 months of Part B, pre-existing conditions can come into play and you might not be approved for the plan switch. Of course, you're probably wondering how much these plans cost. In truth, they can vary widely from state to state. But here are the factors that can potentially play into the premium you pay with the insurance carrier. These are your state of residence, your zip code and county, your age, your gender, and whether or not you use tobacco. Now, what about premium increases? Will these plans get more expensive over time? Absolutely. Your expectation should be that your premium will increase every year. The percentage increase is unknown, but budget for some level of premium increase on a regular basis. Age, inflation, and other factors can contribute to the upward movement. Many people think their rates go up directly related to the medical claims they've experienced in the past year. It actually doesn't work like that. Premiums increase as a whole based on many policyholders' medical service utilization and other factors. What if you move to another state? Your Medigap plan will continue to work exactly the same anywhere in the United States. You just need to alert your insurance carrier of your new address. Keep in mind, this could lead to a change in your plan premiums. The premium would be similar, less, or even more than you paid previously. So make sure to confirm this with your insurance carrier before you move so that you're not surprised. Medigap plans play a key role in reducing your medical cost after Medicare pays its part. Contact me if you need Medigap quotes or have questions about your existing plan.
This has been Sonia Jensen here with you today. You want to learn more? Click the button and subscribe below or visit jenseninsurances.com. Bye for now.